Mhm. Hello, hello. We'll give it a couple minutes just to see if anyone else is going to pop on. Mhm. Yeah, we'll give 1 to 2 minutes, and then we'll get going. Okay. I might as well. Perfect. I might as well just get going. And then if people jump in, that's totally fine. But welcome to those that are here today, and then those that are going to be watching this little recording in the future. And I am very excited to do this talk because it's all going to be about what pelvic floor physio can do postnatally. So this is a follow-up from the previous one that we did for pelvic floor physio in pregnancy. Now we are at the postnatal time. So little intro about me before I get going. I am a physiotherapist. I do both orthopedics, or what you kind of think of with physiotherapy, but I also am a pelvic floor physiotherapist. And I'll kind of talk about what that is in a moment on the next slide. And I've been doing this for a while. I'm very, very passionate about this, and all talks that I end up doing are basically just built from me learning, me experiencing with patients, and realizing that I want to get more information out there to as many people as we can. So this is one where anyone that I know that is possibly having a baby, I am trying to make sure that they know the benefits that can come from seeing pelvic floor physio either prenatally, postnatally, or even later on down the line. So thank you for watching and welcome, and we'll get going. So maybe, there we go. So this is kind of a follow-up from what I did in the first lecture or webinar, I guess, but I'll kind of reiterate. So pelvic floor or pelvic health physiotherapy is the same thing. If you hear either one or the other, it's the same thing. And basically what we are is we're physiotherapists that have extra training in the area in and around the pelvis. So we specialize in being able to test strength and endurance and control of the muscles that are inside the pelvis. You can see them in a little picture here, but there's a lot of stuff going on down there that most people don't really know about. We also have external pelvic floor muscles down for females. They're under the labia or kind of between vagina and anus. And for men, they kind of go up and around base of penis. There's lots of muscles through there that are really important. So what we do is we're trained to look at those muscles and how they're affecting different things. We also kind of specialize in the muscles around that area as well. So we're looking at hips, abdomen, the thigh muscles, quads and hamstrings, hip flexors, all of those things, and how movement patterns or alignment can affect your ability to use these muscles, and how these muscles can affect our ability to do other things and function. We're definitely highly trained in bowel and bladder habits related to incontinence or urgency or just peeing too much. And then we also specialize in pain in that area. So any kind of pain with insertion, with movement, pubic symphysis pain, tailbone pain, anything like that, or sensitization of that area. So that's kind of what pelvic floor physiotherapy is in a nutshell, and kind of what we're looking at, what we do. And so what I'm going to be talking about is how we can use this knowledge to help us postnatally to kind of set you up for success. So it's always very hard to try and put things into categories or kind of pare things down. But if you can look at the benefits of pelvic floor physio or PT physiotherapy after birth, I kind of paired it into 5 different umbrellas. And so the first one is the opportunity to debrief post-birth and ask questions, assess the current state of your body, reconnect with your body, start on an appropriate rehab program, and then a gradual return to appropriate activity. So those are 5 things that I'm going to go into with a little bit more detail, and then we'll talk about what a physio session looks like and how that kind of goes postnatal. For those that are here right now, please throw any questions you have into the chat. I'll kind of monitor it as we go, or really there's not too many of us live, so just unmute yourself and ask questions if you're comfortable with that as well. Okie dokie. So the first thing is the opportunity to debrief and ask questions. Birth is a process, and it is so different for everyone. And oftentimes you go through labor, delivery, then all of a sudden you have a baby that you are trying to figure out. Life gets wild, and sometimes you don't actually stop to think about or talk about what happened during your birth until you're in clinic. So I will never claim to be a psychologist. I will never claim to be an expert in the mental side of things, but oftentimes simply stopping and explaining what happened can be very, very therapeutic. And sometimes being in clinic is the first time that you're able to do that. You're able to look at, maybe there was a bit of trauma that happened, and maybe that is creating some reactions or movements or pain that's going on right now. Maybe you ended up having a birth that was very different than what you were expecting, and that hurts a little bit. Or maybe it was amazing and you want to brag to someone about how great it was. All of those things can absolutely happen in especially that first session. My room, and I'm pretty sure any other pelvic physio's room, is a very open, very non-judgmental space. Anyone can say anything, and it's really time to get things off of your chest, off of your shoulders. And sometimes it's a matter of saying something out loud can be amazing or scary. And so you can kind of try that in that room. You can also ask questions. There is a lot going on social media, on Google. Your body went through a lot during birth, so there's going to be big changes. And a lot of times it's, is this normal? And us pelvic floor physios, especially us that are trained in kind of labor, delivery, postnatal practices, have an idea of what is normal. Firstly, there's no such thing as normal, but what maybe is a little bit more common, or maybe what is unusual. And so again, as I am not a psychologist, I'm also not a midwife, I'm also not an OBGYN, but if there's something where you're like, hey, like I feel a little bit of pressure, is that normal? I haven't stopped bleeding even though we're 8 weeks postpartum, is that normal? And so if we have answers, we can provide them or kind of put you on the right path, or we can say, hey, it is time to contact your OB, or it is time to contact your midwife. This isn't totally common, maybe we just follow up on that. We can also try to help debunk some social media myths. You can see just a simple Google, or go onto TikTok or go onto Instagram and just be like mom hacks. And there are videos upon videos, and some of them are incredible. There's some really great pelvic floor physios or labor and delivery nurses or midwives that have amazing information being put out there. And then there's some very unqualified people with very dangerous opinions that are putting things out there as well. Don't get me started on bounce back culture or anything like that. There can be very unhealthy things. And so sometimes it's nice to just have someone kind of help you weed through what you should maybe be doing and what really isn't appropriate. And this is the time to focus on you. Guaranteed, for the past however many weeks, everyone is checking on baby. You have your parents might be checking on baby. Your partner is trying to help you keep baby alive. Everyone is just focusing on baby and checking on baby because baby is so exciting. But we need to take care of you too. So sometimes, just especially in that first assessment, it can be really a time for you to take charge of your own health, of your own body, remember who you are as a person as well. So that's kind of one benefit of being able to come into pelvic floor physio after birth. The second one is to assess, and this is honestly the most important part because you can't figure out what to do if you don't know what's going on. So when we are assessing the state of your body, and I will get into what an assessment really entails a little bit later on, but what we're looking at is where are you at right now? So this can be for any type of birth. This is a vaginal birth. This is a cesarean birth. This is one that might have involved vacuums and forceps, or it might have been a water home birth that was very, very smooth. It could be any of the above. And we are going to be wanting to look at the perineal region. If you had a vaginal birth, maybe there's some tearing, maybe there are some incisions and some stitches that are healing. Maybe we had a little bit of excess stretch, but your body handled it really beautifully. We're checking for swelling. We're checking for redness. Is there reactivity of the skin? So we're checking externally first and making sure that your body is on the right track. And if it isn't, again, that's when we can get that midwife back in, or we can talk to the OB or even get you back to your GP and kind of figure out what's going on. We'll also look vaginally or internally if you're okay with that. And that's the big thing. Everything is just based on what you are okay with. But if you are, that's a really nice time to figure out if you have sensation or connection in that area. Do you have strength in that area? Can you not only squeeze, but hold? Is there a difference between the front of your pelvic floor and the back? And we're really looking at that to see where you're at and maybe what can be done to improve things right away. Also, even if you did not have a cesarean, we'll probably check your abdomen because you are carrying a baby there. There was almost definitely a diastasis, which is a separation of the abs. And so I added this picture in because you can kind of see two different things. You can see that nice cesarean scar there that's healing pretty well. And then we also can see that there's a little bit of separation between the abs on both sides. Those are those six-pack abs. And so what we can do is there's a special assessment to see what are we at now? So as you're recovering, can we see if things are improving? Can we see if we need to do some pressure-related system work? Is there core work that has to be done? Do you have awareness of your abdomen? Because that's another one that we can lose. Is your cesarean scar doing okay? Which I'll get into in a bit. So really, we're assessing the current state so that you can make the choice of what do you want to fix or work on or improve on? Are you doing amazing? Because that would be ideal. Are there things that you never even suspected could be involved that could then create issues down the line? It's always important that we assess so that whatever you're doing rehab-wise is tailored to you. And you're not just doing whatever the postnatal workout is on Google. You want to make sure that you are spending that precious few moments that you have as a new mom appropriately and effectively. So I've kind of alluded to it already, but we also need to look at reconnecting with your body. And this is because the brain shuts down areas that undergo injury. So we see this all the time in ankle injuries or knee injuries. All of a sudden, if you had any kind of trauma, the brain will say, we shouldn't use that area anymore. And it will kind of dampen our neurological connection to that area. So that means we might have decreased sensation. It might mean that our muscles aren't able to fire as quickly or as strongly. And it's really the brain's communication with you that, hey, maybe we give this area a break, which is fantastic. And it keeps us very safe and it helps us not injure ourselves more. The issue is that sometimes the brain doesn't turn things back on. And again, we see this throughout the body, and that's where a lot of exercises come from, is it's not necessarily strengthening, it's reconnecting. And so we see it a lot of times, again, whether it is a vaginal birth or a belly birth, a cesarean birth, we may completely lose sensation in those areas, especially if there's some trauma involved, especially if maybe it was an emergency C-section that you weren't expecting, or we ended up needing to use some tools, or heaven forbid, they lose baby's heartbeat or something traumatic, then there's a greater chance that we're going to lose connection to that area as well. So if you know that, if we kind of checked and maybe you were willing to do an internal assessment and you couldn't really feel my finger in there, or we are feeling anywhere on the abdomen and you were like, I am completely disconnected, then there is some really lovely ways that you can slowly but surely connect with that area in a very safe and positive way that will improve sensation for the better and make the body realize that that area is safe now. That area is okay and we can use it and those muscles can fire and we are in control. So oftentimes that is breathing. If you have ever seen me or any other pelvic physio, there's a guarantee that you've done breathing. It is our cornerstone because our diaphragm is very closely connected to the pelvic floor. But breathing will also calm down our central nervous system, specifically our fight or flight response in our sympathetic nervous system. So if we are breathing, sometimes we can convince the body that we are, in fact, safe again. We might be connecting that diaphragm to the pelvic floor specifically. So you might have sensation, but if you were trying to squeeze, you have no idea what's going on. So oftentimes we'll connect the diaphragm through breath with that pelvic floor. We might start on just some scar touching, especially cesarean. It's important that early on we are just touching that scar to help the brain realize that it is safe and we can have sensation there. But that also might be any kind of incisions or fixes, scars, I guess you could call them as well, down in the perineal region if we had some tearing. So there are different programs that you can do or kind of processes to follow to help reconnect with your body soon after birth so that 20 years down the line, you don't realize you had absolutely no sensation for a very long time, which can lead to other issues. So this is an area that tends to get forgotten in the grand scheme of things. You know, everyone's working on their core, everyone's trying to lose weight or whatever, but we do also need to really reconnect. And for some people, it's not a big deal. You're already connected. And others, this is the most important part of the process after birth to really connecting with you. All right, then after the assessments, we need to start you on appropriate rehab. And rehab sounds scary. That sounds like squats and deadlifts and running and all this crazy stuff. But oftentimes it's breathing. It's gentle squeezes or relaxation, depending on if we have strength deficits or tension issues. It might be control. It might be, how can I use the front of the pelvic floor instead of just relying on the back? It might be that their strength is really good, but you just can't hold on. So then we need to add in endurance, which is just hold and your ability to hold through breath. It might be that you're totally fine on your back, but as soon as you're standing and walking, we're getting a little bit of dribbling. Okay, now we need to do your strength and your endurance work in a standing position. So it's all about tailoring it to you. And like I said before, you're a new mom. You have very, very little time. We don't want to be doing random exercises that are either not helpful or harmful when you could be doing something that's very specific to the deficit that you have. That could be alignment, that could be core. There's so many different things that it could be, but we want to make sure it's tailored to you in particular. And I promise the stuff isn't scary. Most pelvic floor rehab is very gentle, which is nice. And then we have our gradual return to activity. So this is actually going to be my third and final talk in this session. So I'll be doing a talk kind of mid to late March. I can't remember what the date is. And it's going to be specific to returning to activity postnatally and what we do. But it's important that you know that you cannot just jump back into things. Even if you are an Olympic level, incredible athlete, you're at the athletic peak. Maybe you actually increased your 1 rep maxes throughout your pregnancy. Maybe you're feeling amazing. It is highly, highly recommended by many professionals, a lot of pelvic floor researchers, a lot of OBGYNs. I know the Canadian guidelines and the American guidelines are all on track for no running or impact for 12 weeks. And that is because our tissue needs to heal. And whether or not you had a vaginal birth, maybe you had a cesarean, throughout your pregnancy, your pelvic floor and the ligaments that are through there are getting pressure, especially if we're not really using our pressure systems properly, which does definitely happen quite frequently without us even knowing it. And so it's just kind of putting pressure through there. We are more than able to recover from that, and that's not an issue. But if we add in repetitive impact from running, then it's just putting more and more pressure through there. So that's one that I just spread the word 12 weeks before we start to return to running. Now, on top of that, there are other exercises that are not running, right? You might not be a runner. You might not have any interest in impact. Maybe you want to return to swim. Maybe you just want to get back to weights. And so what we can do is make sure that you have the appropriate strength and endurance to be able to keep things where they're supposed to be, to help you remain continent, to help prevent prolapse while you are gradually returning to your activity. And this is where you have to remember that we are still physios, right? You are not just a pelvis. I constantly have to remind people in clinic, you are not just a vagina, you are a whole human. And so we need to make sure that we're getting you back to these activities that you enjoy. We just want to do them well and appropriately and gradually so that you are just going up as you get back and you're not re-entering it and then injuring yourself, or re-entering and then becoming incontinent, and now you're doing other exercises. So there's a lot of ways that we can kind of gradually return to activity in a really safe, amazing way. So that's the big thing. You can start activity pretty much right away. We just want to make sure that you're setting yourself up for success. And that's really what this is all about in pelvic floor postnatal, is people have been having babies for millennia without pelvic floor physios existing. So you can have a baby, go off into the world and not see a pelvic floor physio, not do any rehab. That's fine. And if that's your thing, all power to you. There is absolutely no judgment. But what this does is it helps set you up for success down the road. Because I do see people in their 50s and 60s where pelvic floor physio wasn't really a thing. And now we're dealing with prolapse, and now we're dealing with incontinence. And there's a chance, definitely not a guarantee, but there's a chance that if they were able to start kind of figuring out what's going on early on, it would be a quicker rehab process and potentially prevent those issues down the line. So that's kind of my spiel on that. Is this is not necessary. It is crazy to say that it is, but there are so many ways that you can really put yourself on the path to success going forward. So a lot of people ask, okay, when should I start? Especially when I see people prenatally, that's really handy because they're already kind of set up and know what's going on. And there's a lot of reteaching instead of learning from the first part. But generally, we recommend 6 weeks after birth. There is a lot of research that's out there. I know some people, there's a really amazing researcher in Ontario that she's also a practicing physio, and she usually recommends 4 weeks. I find that that's a little bit too early. People are still very sensitive. People are still trying to figure out what's going on. Maybe they've had cumulative 1 hour of sleep in the last 4 weeks. So 6 weeks tends to be the optimal time where we have had enough tissue healing, but not so much that it's a little trickier to start or to kind of make those changes. And this is all 100% based on tissue healing timelines. So bones heal differently than muscles, than ligaments, than tendons, but generally soft tissue, which is kind of your bone, ligament, tendon tissue that's not hard realm and not organs, we tend to see healing within 2 to 8 weeks. 2 weeks for those basic ones, for those little bumps and bruises. We've all had those injuries where you kind of roll your ankle, but in a couple weeks, you're totally fine. And then we have ones that are 8 weeks. Ligaments can be up to 12 weeks, or if there's big tears in muscles, that can be up to 12 weeks. But generally, we're looking at 2 to 8 weeks. So that's where that 6 week comes in. But it's really up to your comfort level and what you're trying to do. So if you know that you are trying to return to activity, or you have 3 other kids under 5 at home and you're like, I need to be chasing them. I want to know what's going on right away. Or you feel pressure to return to anything like that, come in a little sooner. If you are just sore and tired and just can't imagine even leaving your house, come in at 10 weeks, come in at 12 weeks. That's perfectly fine. It needs to be when you are physically ready, and remembering that we don't have to go internal either. So you don't have to be perfectly comfortable with having any insertion. We can start externally as well, but overall, 6 weeks is the general guideline. Now, the time that is not appropriate is if your OBGYN or your midwife says otherwise. So I've had a few patients where they had a little bit more tearing that kind of went into the muscle. That's your grade 3 or 4 tearing. And their OB was like, absolutely not till 12 weeks. We respect that. They have priority. They are the ones that we are kind of backing off to because they're the ones that were there. They're the ones that did the stitching. They're the ones that have an idea of exactly what the tissue went through. So if they say 8 weeks, you wait 8 weeks. If they say 12 weeks, you wait 12 weeks. If they say, hey, you're totally fine, then 6 weeks is generally what we're looking at, just for kind of optimization. Now, in those first 6 weeks, it is just, you just want to hang out with baby. This is your time to bond. This is your skin to skin. This is your breathing. This is your trying to sleep in half-hour increments where you can. There is absolutely no pressure to do anything in that time. I have a lot of people prenatally, especially with their first, asking like, okay, like, what should I be doing right away? And really, this is the best advice I can give, is just be with baby. Figure out what life looks like. This might be your first and you're just trying to figure out what life looks like as a mom, or this might be your 4th and you're trying to now juggle another baby. Take that time for you. I was reading some research recently where they were saying that bleeding postpartum, which is normal, which a lot of people don't know, but we do see bleeding for a few weeks postnatally, that tends to be shorter if mom is able to relax, if mom is able to lie down, be with baby, as opposed to be running around. So I really want to encourage that. We don't need to be trying to load baby into the car and get to clinic and you be all frazzled. This is your time to be with baby and do whatever you need to do, or your family needs to do in that time. Now, for those that are really, really keen and really, really gung-ho, I love that. Here are some things that you can be doing. Diaphragmatic breathing. Now, this is easier if you've seen someone prenatally because you already know what you're doing and you can just jump right in. But basically, diaphragmatic breathing is the ability to belly breathe, but it's not just into your belly. We're expanding out the front, out the sides, and in through the back passively. And that's the trickiest part. And that's usually why we review it in clinic all the time, is a lot of us type A people, myself included, if we're not careful, we catch ourselves like kind of pushing out with our muscles. But what diaphragmatic breathing is it is a passive descent of the diaphragm into the abdomen in order to create pressure in through that abdomen. And then as we exhale, that diaphragm comes back up. So really, if all you're doing is just thinking about your belly and breathing into your belly, then you are already well on your way. A lot of people that have seen me will know my glute balloons cue. So the way that we can bring the breath even lower into the pelvic floor and start to connect with that pelvic floor is to think of a balloon in each of your glutes. And as you inhale, think of basically filling up those balloons in those glutes. And I encourage anyone that's watching this to try that. And you may feel a little bit of a relaxation or opening response of that pelvic floor. That is the natural connection between the diaphragm and the pelvic floor. And we use that so frequently, whether we're trying to relax or contract on the exhale. So that's something that can be done right away. It's really nice for connecting back with that pelvic floor. Like I said, sometimes the brain wants to shut it down. That's a nice way to kind of wake it back up and remind the brain that we do have a pelvic floor. And it's also really, really lovely for calming the nervous system and just helping maintain a little bit of core stability. So if you just want to do breathing, you are already well on your way. Other people are like, Ellen, I am a workout fiend. What can I be doing? We can safely start things like glute bridges quite quickly because we're lying down. We don't have any pressure from above. But the rule, absolute rule, no questions asked, is you have to breathe through it. There's absolutely no holding your breath. That should be prenatally as well, but especially postnatally, because we don't want to be adding pressure to the pelvic floor. Cat-cows, very gentle, again, completely pain-free. That's what's in the picture here. This is our cow position, and cat's over here. And just moving gently through those can be really nice for abdomen, nice for lengthening and shortening pelvic floor, really great for the low back as well. Windshield wipers, which is simply just lying on your back and bringing knees to one side than the other. But more importantly, really, is I just recommend getting to some walking. And that might be 10 minutes, right? It doesn't need to be going out for an hour. This could be with baby. Maybe you're pushing baby in the stroller. Maybe we're carrying baby in a carrier, like on your chest. It could be without baby. This could be your time for you when your partner or your parents or a friend are taking care of baby, even just for half an hour. Walking is lovely. Now, walking is against gravity, so we don't want to be doing anything crazy. Usually this is a leisurely stroll, not a power walk, but it is a nice time to, again, connect with your body, not just your pelvic floor. It's like, can you squeeze your glutes when you walk? Because generally, if I am walking this way, we want the fingers that are going backwards, or the legs really when you're walking, that are going backwards to be squeezing the glute. So this guy would be squeezing as it comes back. This guy is squeezing as it comes back. Sometimes it's nice to just connect back in. It gets your knees ready to walk again. It gets your ankles used to pressure again. It can be really nice just for full body and the mind. So if someone is very, very keen about returning back to activity in those first 6 weeks, that's usually what I recommend, is we're taking it easy, but we're maybe trying a few of those things. And then we can start to progress into a core program or weights or whatever you're feeling. The other thing to remember is that if you carried a baby, you are postnatal forever. And so you might be 60 and you had your baby when you were 22. You are still postnatal. Your body still underwent changes. You still went through a birth, whatever that looked like. And so you might have some repercussions later on down the line. And that could be related to the birth, and that can be solved. Maybe not 100%, depending on the issue, but it can be at least improved. And so it's nice to know that, yes, sure, 6 weeks is optimal, but 20 years is also just fine, and you can still make changes. And sometimes you're perfectly fine after birth for like 30 years, and then a couple things might pop up, and it could be related to tension or prolapse, which is a descent of the organs. It could be bladder and bowel control issues. That's the most common one we see. Incontinence especially, but also urgency. We might just simply have some strength deficits that can be sorted out. So if you or someone that you know had a baby at some point and is now noticing changes or issues down there, then pelvic floor physio can also help. And I've worked with people all the way across the board, and it's pretty similar. Treatment is pretty similar, whether you are 30 and just had a baby or 75 and had a baby 50 years ago. It's still assessing strength, it's still assessing tension, and it's still creating an appropriate rehab plan and connection in there. So just wanted to kind of throw that out there, that yes, in this talk, we're really talking about people who are kind of immediately postnatal, maybe within the first 6 months or the first year, but everyone who's had or carried a baby is in that same group. All right, so what do sessions look like? If you watched my pregnancy one for this, I kind of took a lot of these slides and just rejigged it, because our sessions are very similar, whether it's prenatal or postnatal. But the biggest thing is your first session, whenever that is a big talking session, and there is a lot of forms. And what these forms do is they allow me, because I prefer when people bring them back in before their session, I get to go through and I highlight and I take notes and I circle. And if you are on a medication that I don't recognize, I am looking it up and seeing if there's bladder relationships or something like that, tension relationships. It gives me the opportunity to tailor our session and our chat directly to you. Now, in that first session, whether it is your first one ever or your first one postnatal, there's a big conversation because we are going to talk about what you just went through. Now, that is completely based on what you're comfortable with. You might not really want to talk about it, and we just have to go through a few key points so I have an idea of what's going on, or we are going through every detail. Honestly, the more information I have, the better I can help you plan an appropriate program, the better prepared we can be through assessment. It'll give us ideas of if we notice things on assessment, it's like, oh no, that makes sense because you did this, or so on and so forth. So we're going to talk not just about your birth, but pregnancy, labor, delivery, and kind of what the last however many weeks has looked like. That conversation might be 5 minutes, that conversation might be 45 minutes, and that is fine. Generally, the length of that conversation is exactly what we needed. And we want to have time for that because it's usually the most important part. Then we're going to start a physical assessment. Now, that physical assessment will be based on our conversation. So if you had a vaginal birth, I am not checking for a cesarean scar, right? We want to make sure that things are very, very tailored to you. We want to look at your pregnancy. Was it a very active pregnancy? Were you on bed rest? That's possible. Were you just knocked out and exhausted the whole time? That's totally possible. Your pregnancy is going to dictate kind of where we are at fitness-wise, not like pump and iron fitness, but just the function of your body postnatally, and we want to assess based on that. So that assessment is going to be both external and internal. And postnatal is the time where I cannot be more clear that you do not have to go internal. Sometimes people do not want anything near that area, and that is fine. Internal helps us learn more. It helps us really assess strength. That's the best way we can assess strength and endurance and tension and all of that. But there are nice little tricky ways that we can figure out what's going on with the body externally. Plus, there's a lot that you can do externally in that time anyways. So we are looking at your alignment. When you are pregnant, basically, if we're supposed to be in like one nice line, our ribs will start to poke out, and then our backs will create curves, and then all of a sudden our tailbone is kind of tucked under to try and basically change center of gravity based on where baby is. And so our alignment gets totally out of whack when we're in pregnancy for good reason. You have a human on the front of you. But if we can correct alignment fairly early on postnatally, it can actually encourage you to use your diaphragm appropriately because of rib angle and your pelvic floor appropriately based on pelvis angle. And it can make your life so much easier down the road. It can prevent future issues and not being able to use those muscles properly. So oftentimes we're going to look at alignment. It depends, because sometimes we really, really need to focus on strength right away or something else. But oftentimes in the first few sessions, we're going to look at alignment. And how are you moving? Are you able to move your pelvis? Can you move your ribs? All those things. On that, we're going to be looking at breathing, and breathing and alignment go hand in hand. I already talked about breathing. It's very important. We want to see what you're doing naturally, and then what can we do to maybe make a few little tweaks to make things a little bit more optimal. We're likely going to be looking at diastasis either right away or potentially later, because diastasis, again, is that separation of the abs that happens during pregnancy. It is not something to be scared of. It's not something to worry about. It's going to happen. But we want to see, is it changing postnatally? Is it coming together? It doesn't have to, and I cannot be more clear about that. What's most important is, are we able to use our pressure system to not be coning? So what doming and coning is it's basically if we have our two kind of abs, so our six pack, and then we have a little bit of separation in the middle, if all of a sudden we're getting a big pooch that comes out the middle there, that's called, coning or doming. And that is a sign that all of our pressure is going out the front. and that means we're not using our core properly. So oftentimes you can make some quick fixes that can help you on your way to being able to maintain that pressure properly. So that might be something we do quite soon, especially if you don't want to go internal yet. That's something that can be worked on. But also we expect there to be space. So it's more kind of something that we're monitoring and maybe giving some things as needed to help kind of create closure or create a pressure system model. Also, if there was a cesarean, we are looking at your abdomen. So what happens when we have any kind of incision? So this is knee replacements, this is cesareans, this is anyone who had plates in their ankles, we have incisions. And they're going to be likely either stapled or stitched closed. And sometimes those staples or those stitches can kind of get stuck, so we're not really moving properly. Sometimes we'll also see scar tissue come down and kind of just glob down, which is how scar tissue is meant to be, but not start to form nice lines. And so then all of a sudden we have something that we call adhesions or low mobility or motility of the scar, where we might be pushing on it or kind of moving it around and it's just not moving. And that's not optimal for you being able to move in life. If you have to reach something in the top of your cupboard, we need all of that tissue to be able to stretch really naturally. But if everything is kind of stuck there, then it's going to pull and it's going to feel uncomfortable. So if you have a cesarean, there is things that you can do even before the 6 weeks. So email me if that's the case. And I tell all of my prenatal patients that as well, because we want that mobility and sensitivity or pain or anything like that to be dealt with quite quickly. So we want to see where your scar is at this moment. Is there any issue? Is there a deficit, or is it really, really good? And what can you be doing to help it recover going forward? I'm not really talking about this today, but if you or someone you love had a cesarean, please follow the doctor's guidelines about lifting, about moving. I took a really amazing cesarean course that was led by a physiotherapist who had 4 C-sections, and she's a pelvic floor physio, and she's the perfect person to be leading this. And she always tells a story that on her 4th cesarean, she blew her stitches because she picked up a giant bag of rice at the grocery store, and she knew it, and she knew all the rules and all the guidelines, and she was doing all of her rehab, but it still happened because she had a lapse in judgment in that moment. And it can happen, and we just don't want you to deal with that. So please, those guidelines are there for a reason. I know it's human nature to kind of want to push boundaries, but those ones are there, and a lot of research has shown that they're actually very appropriate. So we like those. We're following those. Okay. After or in conjunction with, or even potentially before a date based on what we're doing, we might also do an internal exam. Now, part of the internal exam is also part of the external exam. I never know where to put it, but basically you would still be undressed, and we're looking at the tissue in and around the vulvar area, in and around the perineal region. We're looking at labia. We're looking at if there were any stitches or incisions, how they're healing. Again, same with that cesarean. We want to make sure it's moving properly, which is really, really important. And then we're looking at tension, strength, endurance, control, tenderness, all internal. So what that means is I'm going in with one finger first. So if this is vaginal canal, I'm coming in with one finger, and then it's just that one very lubricated finger that is going through, and it's going to press on different muscles inside. And if we kind of think back to that picture right at the beginning of the presentation, there's a lot of muscles in there. And I want to check all of them, because we might have tenderness or tension from the birth or pregnancy or any time that is not going to be very helpful as you recover. So if that's the case, we can treat that tension the same way we treat it throughout the body, less painful oftentimes. We're also going to look after one finger. If everything's looking good, then the second finger is going to come in right over top, and then it comes out. And that's all it is. So it's just kind of my fingers are hanging out in there. And then we're going to squeeze around it. Maybe we're squeezing and holding to assess endurance. We might be squeezing the front versus the back to see how we're doing with balance. If we think about it, our bladder sits at the very front of our pelvis. So if we are only using the back pelvic floor muscles, then there's an increased risk of bladder issues and incontinence and all that jazz. So that's what I mean by control in that the list is being able to use front versus back. And like I mentioned before, just simply sensation. So it might be like, can you feel my finger as I'm poking here? And if you can't, then we're going to start you on some desensitization or sensation awareness kind of homework so that you can work on that on your own. So follow-up appointments after the initial or the first two that usually it's kind of the first two where we're really assessing different things. Then you get to just show off what you're working on, because I am very homework focused. I think most pelvic physios are, because we want you to be as independent as possible, especially if you have a baby at home. We need you to be able to do most things yourself. And then we are kind of the coaches. You're coming back in, you get to show off what you did your strength improve? Okay, now we need to get the endurance component. Okay, you're doing really great on your back. Now it's time to sit. Your core is developing, let's progress. So this is the top picture here shows a dead bug. This is a very, very common kind of initial exercise that we get into postnatally. We also have bird dogs. This is an intense version. We start with just lifting one limb at a time, or even just simply breathing in that position, but we might be progressing those exercises. We might start to differentiate the front versus the back of the pelvic floor now that you're squeezing well. Your scar mobility might be improving. So now, instead of just kind of pushing on the scar, maybe if the scar is right in the middle, we're going on both sides, kind of cross-country skier style to get things moving. Or maybe things are going so well that we're going across your scar, which is a really great sign, and things are moving really well. So we're going to look at what you're doing and then progress or kind of push you forward based on that. Again, everything we do is tailored to you, so that those moments that you have are going to help to push you physically forward in your goals. Now, the last thing I wanted to include in this is that babies and toddlers are more than welcome in the pelvic room. My pelvic room's a little bit small, so big strollers don't fit super well, but carriers fit perfectly. Babies can be with mom. They can be on your lap. Sometimes we have the occasional kind of 1-year-old who's now exploring a little bit, and mom might bring a blanket and some toys. And there's just one thing in the pelvic room that I need to make sure I take out because it's swallowable. Everything else is totally safe for baby to kind of wander around and do their thing. That's totally fine. And also breastfeeding. Babies need to eat, and I respect that. I wish I could eat whenever I wanted, and I am so happy for the babies that can when they have the opportunity. So if baby is fussy, if you ended up having to make your appointment halfway through lunchtime for baby, that's totally fine. I have had more than enough people breastfeeding while we assess their strength, while we're working on breathing. That's totally fine. You are going to be a multitasker. You're a mom. We're multitasking from now on, right? And so I have no problem embracing that. We will sometimes follow baby around the room while you're doing your exercises. Baby frequently becomes weights during exercises, which is perfect. And so never feel like you have to find childcare or can only come in when your partner is home or anything like that. You bring them on in, and even if they're fussy, we will make it work based on the situation at hand. So never feel awkward or apologetic. If you need to change a diaper halfway through session, that's totally fine. There's other fluids in the room, so there's no problem with that, right? We have wipes. So anything that you need to do is perfectly fine. I am just going to roll with the punches as we go. The last thing too is that in the pelvic room, there is no such thing as too much information, and absolutely no such thing as a dumb question. Like I said at the beginning, social media has so much information out there. Google has so much information out there, and sometimes that can be really overwhelming. So if you need to ask a question and you feel embarrassed about it, please don't. If I might not have the answer, and if I don't have the answer, we're going to work together to find the best possible resources to find the answers for that. And I have heard everything at this point. There is no such thing as too much information. If you are having pain with sex, postnatally and you need to know what a more comfortable position might be, you ask. If you are getting weird fluid situations, please bring them up. If your bowel movements are different, please ask me. Again, I might not have all the answers. I probably don't have all the answers, but I can help you find answers, hopefully. And sometimes I do. And it's just an easy, simple question. So never feel embarrassed about any questions that are being asked. Never feel like you're telling me too much, because really the more information I have, the better I can tailor your rehab experience. Okay, so that's pretty much it. If anyone has any questions, I can answer them now. Just throw them in the chat box. I really like these two pictures. This is assessing for that diastasis. So we're looking at the depth here, which is really interesting. And this is completely normal postnatal. And I really like this one because it shows that little cesarean scar here. We have our stretch marks. And this is a body that gave someone a baby, and that's incredible. And so we never have to be self-conscious in that pelvic floor about anything at all. Okay, I don't see any questions popping up in the chat. So thank you so much for listening, again, to those that are live, but also to those that are watching this in the future. This is my email. It's simply just ellen@activesportstherapy.ca. I don't think I actually introduced myself at the beginning, but Ellen Wedemire, physiotherapist. So just simply ellen@activesportstherapy.ca. I have no problem answering questions or kind of giving people short answers. I can't answer too many things without assessing, but little questions or wondering what an assessment entails or anything like that, please shoot me an email. I have no problem doing that at any point. And then this video is going to be sent out to anyone who's watching it now, but it's also going to be uploaded to our YouTube channel, which is Active Sports Therapy 1. And on that channel are some previous talks that I've done as well on prolapse, incontinence, connection with the low back, trauma, painful penetration, bowel and bladder, and then the one I did last month, which is pelvic floor physio in pregnancy. So if any of those pique your interest, they are available at any time on that YouTube channel. It's really nice to have just a little bit of basic information. And then if you need to use that email for some follow-up questions, by all means, feel free to use that at any point. All right, that is it for today. Thank you so much. I'll stay on here for a minute or two just in case anyone has a question, but if not, have an absolutely lovely evening and thanks for joining me. Perfect. I don't know if you want to stop the recording there.
Hi, Ellen. I've been here the whole time. Sorry.
Oh,
Let me actually stop recording.